How many families right now, Doctor, are thinking about some of the nuances to where we are in this pandemic? Obviously, we've got the troubling news out of Europe and even in the Midwest, upper Midwest here in this country. But just brings to mind, even if you're double vaxxed with a booster, if you have someone elderly coming over your house that maybe got the first 2 shots more than 4, 5, 6 months ago, even you with the booster could still be, if you're asymptomatic, you could be carrying it and give it to this person who probably the antibodies are low enough to where you'd have to worry. So there are going to be incidents during Thanksgiving that are problematic for families, aren't there?
Yeah, Joe, you're bringing up 2 important points. Number one, if you do qualify for a booster and haven't received it, or to your point, even less than 6 months, we know with data, if you're elderly, you probably never got that 94, 95% response. So those are good points. Here's the good news, though. If you yourself, though, are fully vaccinated, including an up-to-date on your booster, it's incredibly low for you to get both symptomatic infections and to likely have viral loads that could infect others. So we still remain safest in our household gatherings if we can make sure that we're up to date on immunizations. I think the other factor to think about are the case counts. If you're coming from an area, if you're coming from Minnesota, Michigan, or traveling to those areas, the community activity is just so high, Joe, that it does pose a risk. But I think, as Meg pointed out and the White House is trying to emphasize, you can still layer things to make that safer. But this intergenerational mix that's going to occur this Thanksgiving with the highest travel in about 20 months is definitely going to see numbers going up. What we are looking for is a decoupling of hospitalizations and deaths, which is what I'm hopeful for, that we won't see those rise at the same levels, which means that these are milder or asymptomatic infections.
There's so many different combinations that I can think of. So let's say that you're under 65 and take a person who's had a booster under 65 and someone who's, 45 and healthy that had the first 2, but it's 4 or 5 months ago. Is there a better chance of them shedding virus to someone than a person who's had the booster? You're saying the viral loads are too low with someone who's gotten the booster, that someone who hasn't gotten the booster could be contagious even though they're not sick.
Right. Your chances definitely increase, Joe, even if you're younger, 40s, 30s even. Your chances increase the more time from that second dose. But make no mistake, we're talking about an efficacy that's still in the 50s and 60s, and okay, that's really good. It's just that you still have that risk. So we're all facing some of these scenarios. The most common ones patients are telling me about is that they've got a younger person who has had a known contact with somebody who's positive, but they're vaccinated. What do they do? Do they get on the plane? Do they travel? And I think that we still have to have confidence in these vaccines. So I wouldn't tell people to cancel all Thanksgiving trips if it's vaccinated individuals, no symptoms. I think symptoms should really be a defining boundary, Joe. If you're symptomatic, even a drippy nose, stay away. It's not worth the risk if you've got older people in your household.
Doctor, if you're over 80 and you don't have a booster, should you be going over to a family's to a family where there's going to be a lot, where you don't know where everyone's been, people from out of town? Isn't that a fairly questionable amount of risk?
Right. I agree. I think that if you've qualified for a booster and you're in even over the age of 50, I would say, Joe, which is based on the data we've seen from Israel, now the United States and the UK, we do see a pretty decent bifurcation above the age of 50, where if you've qualified for a booster but haven't had it, those are the persons who are more likely to have breakthrough infections that could lead to more moderate or hospitalized illnesses. So those are people that I would say, but here's the good news, Joe. It's not too late. You can get your booster today. If you're traveling tomorrow or Thursday or getting into gatherings, we know that we'll see some antibody response at 48 hours, optimally at 7 days. But don't discount the ability to actually have an effect and to do the things that kind of we mentioned before, testing. If you're at high risk, put a mask on. Avoiding the trip altogether is something you have to make an individual decision. But you're right. If you're elderly, you have not had a booster, you're taking a calculus, especially with case counts. 100,000 cases a day and climbing. Northeast and Midwest in particular are dangerous zones to travel into.
Shepard Smith here. Thanks for watching CNBC. on YouTube.